The Kenya government has rolled out mass testing for COVID-19 in some parts of Nairobi, which is being particularly struck by the virus. The Kenya Medical Association is boosting its capacity to train all healthcare workers in the front lines of fighting the disease. Africa 54's Pondiho spoke to Dr. Jacqueline Kitulu, president of the Kenya Medical Association, about what they are doing to help curb the spread of the virus.
Dr. Jacqueline Kitulu, welcome to Africa 54. How are you?
I am very fine, thank you, Paul. Thank you for inviting me to your show.
Bring me up to speed. What is it that your umbrella organization, the Kenya Medical Workers Association, is doing to fight COVID?
Our mission, it's actually a twin mission, which is doctors' welfare and championing for quality healthcare to the public. So in those two areas, of course, our mission cuts out what we are doing in the context of COVID. We are at the forefront. We are sitting on the Ministry of Health COVID Task Force Response. We are sitting in the case management, in training, communication, as well as represented in the National Coordination Center for Quarantine and Isolation Facilities. If we are the foot soldiers, then we need to adequately train our foot soldiers. So one major area we have taken part in is in the training. And what we have done is actually to ensure that that training can be availed online. We are training healthcare workers at different levels in different parts and using our branches. That's part of what we are doing to disseminate the training. Part of the technical teams offering the professional advice in terms of certain decisions that are being made.
I'm wondering what the Kenyan government has done and to what extent has the organization that you lead maybe been at the forefront of making sure that the people you lead stay safe, the doctors you deal with are safe.
So our advocacy really to the Ministry of Health has been in terms of the need to recruit adequate human resources for health, not only doctors, but we are looking at the whole healthcare workforce, the nurses, the radiologists, laboratory technologists, even just in the area of testing, that you need inadequate technologies to take samples, to run samples. In the hospitals where we've had even any cases at all, and healthcare workers have been exposed, there's one particular hospital actually which had to put into quarantine 40 of their staff. Wow. You can imagine what that does to the functions of that hospital when you put 40 people in quarantine. Advocating to healthcare workers that do not put yourself in any dangerous situation. You must have the appropriate adequate PPE. So that is, we are pushing the government to ensure that there is adequate PPE. And that will ensure that, therefore, as healthcare workers, we are not only responding to COVID, but we can also deal with all the other issues. There are chronic illnesses, there are other acute illnesses, which would suffer if healthcare workers fear to go and deal with patients because they feel they're not adequately protected.
There is a lot of emphasis even here in the United States about testing. A lot of people are going to know that they're actually sick or they have contracted COVID-19. Is the Kenyan government or the facilities in Kenya able to test people?
Okay, so indeed our strategy even as a country is test, isolate, treat. So testing is critical. Indeed, you can't fight an enemy who you can't see. Now, the challenges around testing have been, of course, around testing kits, the availability or lack thereof, the sample collection kits. In fact, now the greatest challenge we've had is the nasopharyngeal swab. But in terms of capability as a country, that is very clear. We do have the capability. So in essence, and the machinery is there in terms of the equipment needed, the expertise in the labs is there, and especially with the automated systems, those are available. So if we can have enough kits and enough sample collecting kits, I think we can move to a level of testing at maybe not mass testing, because the numbers that you require for it technically to be defined as mass testing, maybe those are excessive numbers. But yes, in terms of a wider mode of testing, I think that we can go in.
The social distancing guidelines in Kenya, how has it impacted people, and how is it effective? Can it really work in the context of Africans being very sociable people?
The challenge is there because indeed you have people, maybe 5-6 people living in a 2-room house. How much social distancing can you do there? But in terms of the distance therein lies our major challenge. how much can you, the socialization or even the infrastructure, the sort of dwellings we have in certain areas don't allow for social distancing.
I have to commend you for being out there on the front lines, doing the very best to save lives. For that, I have the highest respect for all the doctors on the front lines. And thank you so much for your time.
Thank you.